The gentleman from South Carolina is recognized for 5 minutes in support of his motion. And the House will be in order if the gentleman will suspend. The House will come to order. The House will be in order. Gentleman may proceed.
Thank you, Madam Speaker. Madam Speaker, last month, Republicans voted to end Medicare. According to the Nonpartisan Congressional Budget Office, their plan would raise seniors' health care costs by more than $6,000 per year, doubling their out-of-pocket costs. Now, this week, Republicans want to cut training for new primary care doctors. This is another part of their attempt to repeal health care reform piece by piece.
Gentleman will suspend, and the gentleman from Maryland is correct. The House is not in order. The House will be in order. The House will be in order. Members are advised to take their conversations off the floor. Gentleman from South Carolina is recognized to proceed.
Thank you, Madam Speaker. Madam Speaker, there is bipartisan agreement that we need more primary care physicians. Yet Republicans are bringing up a bill that will make sure that even fewer primary care doctors are trained to meet the growing demand. This is a terrible idea, but not surprising. I oppose this bill because we need to be training more primary doctors, not less. But at a minimum, we must ensure that the nation's neediest areas have access to the doctors they need. This final amendment will ensure that training programs in the area most in need of primary care are to be prioritized for funding. This is common sense. My district, like so many others represented in this body, has some very rural communities. In many areas, families have to drive for dozens of miles to reach the nearest doctor. People who live in remote communities like Britten's Neck and Salters travel great distances in search of primary care, and many don't have public or private transportation. This is not just an abstract debate about compassion. For many people, it is literally a matter of life or death. Madam Speaker, we all know that for decades, many communities across the country has been left out of the American dream year after year after year. We call these places persistent poverty counties, counties where more than 20% of their populations have been existing below the poverty level for at least 30 years. Approximately 15% of counties in America qualify as persistent poverty counties under this definition. Madam Speaker, may I have...
The gentleman will suspend. The House will come to order. The House will be in order.
Thank you, Mr. Young.
Gentleman from South Carolina may proceed.
Because the majority of these counties are rural, they only comprise about 7% of the nation's population. These are the places that this amendment targets for funding. These communities are diverse and spread across the country, including Appalachian counties in Kentucky and West Virginia, Native American counties in South Dakota and Alaska, Latino communities in Arizona and New Mexico, African American communities in Mississippi and South Carolina, and urban communities in Philadelphia, New York, Baltimore, and St. Louis. So I say to my colleagues on the other side, if you're going to cut funding for training new doctors, let us at least ensure that the communities with the greatest need are placed at the front of the line.